Hi everybody, my name is Tina and I am a Keys coach on the business side of Keys. I want to primarily talk to the family childcare homes and just talk a little bit about what is your orientation when you have a sub or an employee in your childcare facility and home. Other than the required forms that we have to put them on our roster, but do you train them about your expectations on training? Right? If you're a school readiness or a large family childcare home, you're required 10 hours of in-service. But if you're not a school readiness or a large childcare home facility, still you're allowed to have your expectations on what you require for training. You want them to continue on and learn about children and keep that professional development going. You want to hire the best of the best when you're not there to take over in your position, right? How about an emergency plan? Going over your emergency plan. Do you have emergency bag? Right by your door. It has all your children's information in case there's an emergency. So when they take that bag, where do they go? There's a fire alarm going. They're alone in your home. They can't go investigate why it's going off. They should just immediately take all the children out, know how many children they have, do head counts, take your attendance sheets, and where do they go? And then what happens when they get there? They're alone, right? So how does that work? And what does that look like in your individual environment? Bathroom breaks. You're there alone. They're there alone. What do you require? Do you require them to sit in the hallway looking at some books? Do you have a bin that they can be entertained with activities, a safe area? So while you go into the restroom, obviously you need to make sure that they're well taken care of, right? Again, you're alone. So what does that look like? And then what if DCF comes knocking at the door? Where are the files? Where are all the necessary things that DCF will ask for? They should be knowledgeable to know their ratios and know each and every child's name and know the activities they're supposed to be doing and the schedule, and actually getting a hold of you immediately so that they can feel comfortable when DCF comes, right? And then maintaining a record of hours worked. Obviously, that is a requirement of DCF. If they are working alone without supporting you in the environment, then they need to maintain records and keep up, of course, everything for a year. Just something simple to keep in mind that a lot of subs are on multiple rosters for family childcare home, and every home that they enter has different expectations, different rules, different things. So when then you come into your home, you want to make sure that they're following your rules, you know, when it's appropriate, if they're using their phones and your activities. And there's just some family childcare homes that don't have that stringent schedule, and maybe you do, and you really want to make sure that they follow, because they will just assume and continue on what's best for them sometimes versus what's best for the children and what you require. So don't forget, you are a business. You should have some little orientation guideline to follow, nothing so big, but something that's really, really serious. You will not put health and safety in the way of anything, and you want to make sure that you interpret that and have it in writing as well, because you know you're an amazing provider, and you have awesome children and families to attend to, and you want to put it out there. So good luck. Thank you.